Welcome back, crackheads. Dr. Chris here, and today's pop star is going to be Thuan, and Thuan is getting his first adjustment ever. Thuan, how do you feel right now?
I feel like I need some crack, man.
All right, cool. Well, you are in the right place. We're going to get tons of good cracks today. Okay, you ready to go?
Yeah, let's go.
Perfect. Let me have you start by lying face down. So facing the paper there, arms down below your head. All right, let's go. All right, first we're going to do a nice little massage, okay?
Sounds good.
All right, perfect. So I just want to go over what we do as a chiropractor real quick, just since it's your first adjustment ever, okay?
Yeah.
So as a chiropractor, the injuries that we treat are called misalignments. And misalignments are just any joint in your body that's out of place. It's not where it belongs. All right, and when that joint is out of place, that's going to do a couple of things. That's going to irritate the nerve that controls that joint. It's going to cause inflammation. It's going to cause muscle spasms. And then that can ultimately cause pain. All right, and you get these misalignments as a normal part of life, in my opinion, because no one has perfect form or perfect posture. Would you agree?
Yeah, I agree.
So literally, since the day you're born, we're constantly doing things off balance on a daily basis that are going to cause these misalignments. And then on top of that, if you're ever in any traumas, or you fall, you get hit in your back, any of those traumas, sitting for long periods of time can all cause misalignments as well. All right, so just real quick, have you had any traumas in your life? Any car accidents? Ever fall off a trampoline?
So I've been in one car accident about 5 years ago, but to me, I felt like it was minor because I didn't have any pain.
Okay, so that car accident, even though you didn't have any pain, I can guarantee caused misalignments. All right, because again, like we just talked about, you get misalignments just from sitting for long periods of time with poor posture, just from sleeping the wrong way, just from sitting with your legs crossed. So if you're ever in any traumas like a car accident, that's definitely going to shift your joints out of place, and you always want to get adjusted after any type of trauma, especially a car accident. All right, because if you don't get treated for those injuries immediately, they're just going to get worse and worse over time, and I guarantee you're going to end up with pain down the road. Does that make sense?
Yep, it does.
And then even though you're not in pain, like today, you're doing the right thing coming in, because chiropractic, the greatest benefit of chiropractic is preventative. All right, so we keep everything in place where it belongs. That's going to prevent pain. It's going to prevent future injuries. And most importantly, it's going to prevent the degeneration of your spine. All right, so it prevents arthritis. So first I'm going to start by just feeling your spine. I'm going to feel for any joints that are out of place, and then we're going to put them back where they belong. You ready?
Yeah.
Okay, so if you have any pain, I want you to let me know, okay?
I do.
Okay, any pain through your thoracic spine?
Nope, nothing so far.
Okay. All right, so your thoracic spine consists of 12 vertebrae through your mid and upper back, and your thoracic spine is defined by all the vertebrae that are attached to ribs. So any vertebrae in your thoracic spine that's out of place can also shift your entire ribs, can cause pain that radiates to your chest, digestive issues, and difficulty breathing. So we're going to make sure these are all where they belong. Okay, a little off to the right here. All right, so what we're going to do is we're going to contact the left side, tissue pull these joints back over to the left, and then set them back down into place. All right, you ready?
Yep.
Okay, let me have you take a big breath in. Good, and let all the air out. Good, nice and easy. Nice. Yeah, that moved good.
Oh, that felt right.
That was awesome. Okay, now we're gonna little off at your CT junction. All right, your CT junction is where your cervical spine meets your thoracic spine. So this is a very, very common area for misalignments because it's where two alternating curves meet. All right, so we're going to put these back in place. We're going to start here at like T1 off to the right. We're going to pull this over to the left. I'm just going to push your head to the side. I want you to just relax for me, okay? Nice and easy.
Oh.
Yeah, good. Perfect. And then same thing on the other side. Okay, you just relax, nice and easy. Good. Okay, you can look straight down. Perfect. How'd that feel so far?
I felt like I should have done this a long time ago.
Yeah, exactly, man. But I always say it's never too early or too late to get adjusted. So chiropractic, fun fact, safe for all ages. I treat patients in their 80s, and my youngest patient ever was 36 hours old. My friends invited me to the hospital to adjust their newborn.
Wow, that's crazy.
Yeah, it's pretty cool, right? Okay, so now we're checking your lumbar spine. Any discomfort here?
Nope.
Okay, so your lumbar spine is important. Your lumbar spine consists of your 5 lower vertebrae, okay? And a lot of lumbar misalignments come from people who sit all day, all right? Sitting is the worst position for your spine. So if you're out there and you have low back pain, can't get to a chiropractor, just try to decrease the amount of sitting that you do. So what I recommend is, first of all, getting a sit-stand desk if you can. But if you can't do that, at least set an alarm and make sure that you're standing up every hour to break up that sitting. Okay, so a little off to the left here, we're going to use what we call a chiropractic adjustment tool. And what it does is it just taps your joints back into place. Okay, so if you guys can see the spine real quick. So what we're doing is we're literally, if this joint's out of place, I'm literally going to come onto the side here and just tap this joint back into place. All right, so that's what we're going to be doing on Thuan here. So I want you to just relax for me, okay?
Mm-hmm.
All right, I'm going to tissue pull, again, these joints over to the right, and then tap them back into place, nice and easy. Okay, perfect. All right, good, good. Okay, that feels better. All right, now we're going to check your SI joints. All right, so your SI joints are where your ilium, there it stands for sacroiliac joint. Okay, so it's where your sacrum meets your 2 hip bones on either side. Okay, and a lot of people suffer from SI joint dysfunction, which is when one of those 3 bones is out of place and it causes pain in this area. All right, it can also, SI joint dysfunction can also cause sciatica as well. So we're going to make sure these joints are in place. First, we're going to check your sacrum. So I want you to keep your right leg straight. Raise it as high as you can, straight up off the table. Good, you can let it down. And then do the same thing on the other side. Good, and let it down. Okay, was one side harder or more painful to raise than the other side?
Right side. Okay,
so I want you to cross your right foot over your left foot for me. All right, so what that means is that your sacrum is rotated clockwise. Okay, so that's definitely going to cause SI joint dysfunction. All right, even if you're not having pain, we want to correct that so that these joints don't degenerate. All right, so for this, the table's going to come up, and then it's just going to drop back down. All right, so I want you to just relax, nice and easy. We're going to rotate this tailbone back in place. Good, 2 more. Good, last one. All right, good. You can uncross for me. Okay, now we're going to check your leg lengths. We want your legs to be the same length, right?
Mm-hmm.
Okay, let's see what we got here. Okay, so we look at the medial malleolus on the ankles here. All right, because some people look at the shoes, but the shoes can be deceiving. All right, your ankles don't lie. Okay, so I don't know if you guys can see this here, but if you look at where my hands are, this right leg is slightly shorter than the left. Okay, so what that means is that Thuan's hips are out of place. All right, so instead of being like this, your hips are like this. All right, so your right side is posterior and inferior, and your left side is anterior and superior. So we're going to put your hips back into place. So I want you to turn on your side facing towards me, please. All right, good. I'm going to lift this up for your head. Okay, and then we're going to have arms here. Good. This knee up for me. Good. Bring it a little closer. Good, and you just relax, all right? Just gonna push this hip in place, nice and easy. Good, perfect. Good ones there. All right, let me have you turn to the other side for me. Nice and easy. Perfect. Same thing. Knee up. Good. Gonna come a little lower on this side, same thing. Nice. Perfect. Good. You can lie on your back for me, face up. Yeah. How'd that feel?
Good.
Perfect, man. All right. Good job.
Who knew I needed a crack in my life?
Yeah, man. All about the crack. Perfect. And then those legs are just about even now. That looks, yeah, perfect. Right on the money. All right. Good job, Thuan. Just relax. All right. And then the last thing we're going to do is we're going to check your cervical spine. Okay. So a lot of issues in the neck or the cervical spine come from anterior head carriage, all right? Or where your head is in front of your shoulders, and that comes from people just constantly looking down. We're always looking at our phones, we're looking at tablets, we're looking at computers all day, and so it's all angled downwards. And what happens is that causes your neck to straighten out. And when your neck straightens out, that causes problems. So the best thing you can do at home is try to restore what we call that cervical lordosis, or that curve back in your neck. Okay. Sorry, I just want to feel real quick. So just real quick, good tip for that is if you work at a computer, I want you to find a big box, put it on top of your desk, and then literally take your computer monitor and put it on top of that box, so then you're looking upwards at the computer screen. That'll help to restore that cervical lordosis. Okay, so I want you to just relax, all right? I'm gonna feel for motion in all the joints in your neck. If you have any pain, let me know, okay?
Will do.
But shouldn't hurt. Any discomfort at all?
Nope.
Okay, a little tight, maybe like C2, C3. So I'm gonna just push these joints back into place, okay?
Okay.
So you just relax, nice and easy. There you go. Good, you all right?
Yep.
Perfect. All right, that moved good. And then last one. Okay, same thing, just relax. If you have any pain, let me know. Okay, right at the top here, like C1, C2, nice and easy. Good, perfect. All right, Thuan. Awesome, man, good job. So we just put all the joints in your neck, your back, your pelvis back into place. All right, let me help you up.
Yep.
Okay, come on up. All right, perfect, man. So again, by putting all those joints back into place, all right, that's going to remove any nerve irritation, and it's going to restore proper function.
Yeah.
All right, so those joints are going to function the way they're supposed to, and they're not going to degenerate.
Yeah.
Okay.
Perfect.
So how do you feel?
Feel good.
You going to come back?
Oh yeah.
Awesome.
Every month.
Perfect. Well, thank you for coming in
Yeah.
today, man. All right,
you.
you did great. And yeah, we'll see all you guys next time. Thanks for tuning in.
Yeah. Shout out to Dr. Chris.
Thank you. Thank you.